you. Okay, thank you. So now we're done with our word cloud. It has been so interesting to see so many diverse opinions on just the word abortion. And now I'm going to hand over um the mic to Mrs. Ufoma
How
to
do you know
take
I think
on
observe
the
this class?
next session. Hold on, I think I need to mute somebody. Um, who is even speaking? Okay, all
Hi,
right. So
Max.
I'm going to hand over the mic to Mr. Farmer to take on the next session of this event. Thank you.
Thanks so much, Bimonat. Thank you, everyone, for that insight into what comes to our mind. Please be rest assured that this is a safe space, and so feel free to have, you know, share your thoughts the way it is. Our intention is for us to have a place where we can run mind and talk about this um, topic without feeling ashamed or without feeling any form of stigma. So the next activity is for us to just do a pre-evaluation, just to know what would we know about this subject that we want to talk about today. And at the end of the conversation we're going to be having today, we'll also be doing a post-evaluation. This is supposed to be like an insight to our minds and what we've been able to learn or take out from this activity, because we project for young people, so we want to have real data that we can speak to and say, okay, oh, at the end of this conversation, one or two persons, shared one or two about their thoughts or what they've learned during the process of this conversation. So I'll be sharing the link in the chat. Please, we would the first question is asking about your name. We would have used the number because it's not really like we want to use your names for anything specific, but in trying to measure what you feel after. That's why you see name there. But feel free to use any name that you can identify, or that we can identify. For example, if you use maybe stone, for example, when you're using the post, you can also use stone. Yeah, that's what I'm just trying to say. So don't necessarily have to use your name, but use a name that we can identify that this person feel this pre and also feel the post. So I'll be dropping the link now. We'll just be doing that briefly for the next, let's say, 5 to 10 minutes. They're just set of questions, just yes, no, strongly agree, disagree. All right, please, if you are just done filling, just for us to be able to track the number of people that have filled, you can just drop a thumbs up or just say done in the chat. That would also help us to track the number of people that have filled and also work with the time. Thank you so much, and I look forward to seeing our responses at the back end. MHR, you can just help us with some soft music. It's supposed to be a hangout. It's unconventional, but that's the idea. Thank you.
Thank you very much, Akin. Please just click the link. We really need everyone in the room now to fill this form. If you check the chat, you see a link posted by Akin Oladabiri. Please just fill that link within the next 2 to 5 minutes, and we can quickly move to listening to some very important insights from our guests on the ground. Let's keep in mind that this hangout is going to be a relaxed and fun one. Beyond having us listen to some very needed questions that we gathered from our community, we would also be having a short quiz, a quiz that some people in this room currently will be winning 5,000 naira each, and it's going to be cash, of course. Yeah, so let's stay tuned. Let's stay tuned. And if you have people who haven't joined yet, know that feeling of the African time. We are beginning to turn it to the Nigerian time now. You can just prompt them to join. We'd really like as much as we have to fill this form. Thank you. I would copy it again and repost it so that If you are just joining, you'd be able to see it. Oh yeah, thank you. So please, we are hoping that we take the next few minutes to fill it, just the next 3 to 4 minutes. I'm hoping that everybody is currently filling it now. The moment you are done filling, please just put it in the chat and say, "Oh, done, done," or just put up an emoji so that we can move on. At the plain. Okay, I see you, Ruth eBay. Thank you very much. Chineye, thank you very much. If you've not filled, please feel as fast as you can, and then we can move on. I'll just be playing a little bit of sound for like a minute while I wait for the more emojis, more dawns, more I'm done feeling.
There's also no that. Sure. Thank you. We have 12 people that have filled.
Thank you to everyone who has filled. We'll still be placing this for you who haven't filled yet. Okay. So okay. Let me just quickly confirm. Please, is Dr. Eno in the house?
Yes, I'm here. Hello,
Oh,
everyone. I'm here.
thank you, Dr. Eno. Okay, so I think my introductions are complete. Okay, I'd like all of us to please join me to acknowledge the fact that we currently have our complete guests in the house. We have someone who is particularly important to MHR beyond our beyond the
Let's
fact that
see.
Hello? Okay, Memunat, please, if anyone whose mic is unmuted, please help me mute because sometimes some people don't know when they unmute their mics. So please help us be on standby to ensure that as mics are getting unmuted, they are getting remuted. Thank you. Okay, yeah. So as I was saying, I was saying that I'm very happy to welcome Dr. Eno, who beyond being a very important part of the partnership that MHR is very connected with the Amaze network. Dr. Eno is also a US board certified clinical sexologist and an SRHR specialist. Welcome to our youth hangout, Dr. Eno. Thank you. And then,
Thank
of
you.
course,
Thank you very much.
thank you, Dr. Ina. And then, of course, we have our executive director, the executive director of Media Health and Rights Initiative of Nigeria. In case you did not know about MHR, we are an organization that is not only sexual and reproductive health passionate. We're an organization that is very youth focused. Sometimes people might say we are partial to women, and that will be true because we are boldly feminists as an organization, but we are very, very in tune with youth. And the ED of the organization is very, very attuned, of course, with youth because the young people of this country not just make up a very large population of the country, they make up the target and the target audience, the beneficiaries of many of our interventions, adolescents and young people. So I'm going to also welcome the ED of MHR, Alu Azigi. Welcome, ma'am.
Thank
So
you, Foma. Thank you.
okay, thank you. If you are just joining, you can fill the form. Yes, if you check in the chat, I see that some people are joining currently. Just check in the chat and fill the form that you see there. It will really help us to evaluate where your thoughts are when it comes to some specific SRHR subjects that might be tackled today. One beautiful thing about this conversation is that we are very, very big on choice. We believe that when young people have all the information that is needed for them to make choices, they would make informed choices. So beyond what some people may say that, young people nowadays, they just make anyhow choices. We don't believe that. On our end, we believe that if you arm people with enough knowledge, they're able to choose right, they're able to think and know better, and then do some very, very important things with their lives and their decisions and their bodies, of course. So throughout this program, you might be hearing choice, choice, choice here. It is for a reason. It is for a reason. Okay. I'll be starting with Dr. Eno. Dr. Eno, from your experience working with young people, what are some of the biggest misconceptions you've encountered about sexual reproductive health? And why do you think that these myths and these misconceptions continue to persist, even with all the amount of information going out on digital platforms daily?
Yeah, thank you. Thank you very much for the opportunity. I must say that I'm very happy joining this hangout. And thank you very much, MHR, for the invitation to join, this hangout. I think it's quite timely, such conversations, and especially when we talk about sexual and reproductive health. And I hope that I'll be able to join future sessions as well. And thank you very much for the question. It falls really within the work I do. And really, based on my experience, I think one of the main or biggest misconceptions that young people are having is that I think young people are getting a lot of information about sexual and reproductive health. But in reality, there's a lot of misinformation. And for example, as a sexologist, someone could say that the withdrawal method is a reliable contraceptive method. It's a misconception. It's not accurate. But there is a lot of information around the withdrawal method. So the problem really is many young people are misinformed rather than receiving accurate and evidence-based education. You could also say that you can't get pregnant for the first time you have sex. That's a misconception. Or talking about sex encourages young people to become sexually active. That's a misconception. And so for me, as a reproductive health clinician, I have noticed that there's a lot of information around sexual and reproductive health, but it also comes with a lot of misinformation. And I think there is more work to do when it comes to accuracy, but also evidence-based education around sexual and reproductive health. And if you ask me why these myths persist, it is because many young people rely on social media. They rely on social media. Some even rely on their friends. Some rely on I hear say if you drink honey and limes, you go move belle. I hear say I hear say when man just have sex with for one time, if you just try, go carry belle. The chances they be very low, say go carry belle. I hear say, in many communities, sexuality is still a taboo. So young people rely on social media, they rely on their friends, they rely on their peers to get information. And because of that, they get the wrong information. It makes it difficult for young people to openly ask questions. I can't believe that in 2026, a young girl will reach out to me to ask me if honey and limes can make her abort the pregnancy in 2026. It's a reality. We live it every day. And so silence really creates a space for misinformation to thrive because young people don't have an open environment for open conversations. They tend to get it from their friends and peers. So the solution is not less information. The solution is better, really scientifically accurate, but also non-judgmental sex education. We judge young people a lot. We judge them. We judge their reasoning. We judge their questions. We judge their feelings. We judge what they think. And because of that, they shy away. They run away. And when they run away, they get into problems. I can tell you within my practice that most of the problems young people face as far as SRHR is concerned is because of misinformation. One thing my father always tells me is that information is power. It's what equips you to make informed decisions. And so if you don't have the right information or the accurate information, you will make the wrong decision. Once you know that if you have sex for the first time and you wouldn't get pregnant, you can imagine what would happen if somebody gets pregnant on an unwanted pregnancy. That's already a pregnancy which is not wanted. It comes with a lot of problems and a lot of difficulties. So to me, really, I see misinformation as a very serious problem. And it is because young people rely a lot on social media and on their peers rather than on, healthcare providers, on parents, and on other accurate means of getting information. So to me, that is how I would answer that question. Thank you and over.
Thank you very much, Dr. Eno. We have to agree that misinformation is a very big problem. A question came into our inbox recently where somebody asked if we foresee a time in the African communities where people would be able to talk about sex even more freely than they are, because the person was trying to note that he believes that maybe in the older days, probably in the the late 90s, and then the early 2000s, I mean, sex was still the word sex was still very taboo-ish. And he had just been waiting for a time when you just be able to see people speaking about matters that concern sex without being shy, being ashamed, wanting to be secretive about it. And he was asking us if we foresee a time when it will be free for people to just talk about, oh, I have so sex problems and all of that. And to be honest, myself, I really couldn't answer the question. I don't know if you can take a shot at it, Dr. Eno.
Yes, yes, definitely. I think we are a bit progressive in Africa when it comes to conversations around sex. It is true that we have our cultural, religious, implications that affect what we say and how we think and how we reason. But we are trying as much as possible to make it known that discussions about sex is not a taboo. It is not an abomination. It's an open conversation. The truth is, everyone needs to talk about sex and know about sexuality. That's the reality. Because at some point in time, whether we like it or not, it's going to affect our lives, whether directly or indirectly. So I think that we need to be more open to having such conversations, very open, because it is going to happen, whether we like it or not. As young people, as older people, if you have children, you at some point need to talk to them about sexual and reproductive health, how their body functions. It is about our body. Now, the challenge is this. We are not talking about a mirage or something in the air. We are talking about our bodies. How do you avoid your body? It is your body you see, it's your body you talk to, it's your body you rely on for survival. And that body has body parts, that body has feelings, it has emotions. And as a doctor, I always say that health is not only about me being physically okay. Health is a state of complete mental, physical, psychological, emotional, and some people even say spiritual well-being. It means that if my emotion is broken, I am not healthy. It means if I am mentally suffering from a problem, I'm not healthy. So health goes beyond malaria and typhoid and fever. There is the emotional aspect of health. So we need to be open about having such conversations, talking about our bodies, knowing how our bodies function, know how to treat some diseases, and talk about sexuality. We have to be open about it. And I'm happy that in 2026, there's some progressive work that has been done in terms of trying to push for such discussions. But again, more needs to be done. More needs to be done, especially around things around, pleasure, intimacy, abortion. It's a conversation that need to be spoken more of the time because young people are facing it. Contraception, young people are facing it. Why is it a taboo to buy a condom? Why is it a taboo for a young person to work with a condom? Why is it a taboo to talk about abortion? Why? Why can't I talk about intimacy, how I feel having sex? I always give this example that in 2018, I was in Amsterdam and a young girl came to me in a hospital setting, 18 years old girl, and told me she wants to consult before she has her first sexual intercourse. What can I advise her as a doctor? And coming from Africa, coming from Cameroon, I was shocked actually. I must be honest. I was shocked that a young person comes to me and tells me, Doctor, I'm a virgin. Can you advise me on how to prepare for my first sexual experience? I wasn't taught that in school. Oh. So where do I begin telling this young girl how to prepare herself for her first sexual experience? That's to tell you there's a lot we're not talking about. There's a lot happening which we aren't talking about. Nobody prepares you for sex. Nobody prepares you for menstruation. No one prepares you for pregnancy. No one prepares your mind, your soul, your body. Just takes you by surprise. And then you start having a lot of problems because you were not mentally prepared. Okay, and so to me, I think that we still have a lot of work to do. I am one of those doctors and healthcare providers who promotes pleasure, pleasure-based sexuality, who promotes body autonomy. Your body belongs to you. No one decides what happens to your body. But there is still a lot of issue when it comes to such discussions. And I think young people listening to me, you have to be open. When you're open, you get the right information. Be open. Talk to someone you trust. Be open about your sexuality. Talk to someone you trust. Don't hide it. If you need an answer to a particular issue, get to a healthcare provider. Express yourself on what the issue is and get help. Because again, there are many preventable problems we have. I am talking about this because I know from experience difficulties young people face when it comes to sexuality, to sexual and reproductive health. As a young person growing up, even my own parents did not talk to me about sexual and reproductive health. I learned from other sources. And I know what young people can go through. So, young people listening to me, talk to a healthcare. If you have any challenge, you could be having a discharge. You could be having an emotional breakdown. You could be crushing on somebody, even. Nobody talks about love. It's okay to love someone. It's okay to crush on somebody. But they make you feel as though you are going to hell the next day because you're crushing on someone. That is the life we have in Africa. But we must talk about it, we must be open about it, and we must help young people navigate sexual and reproductive health. Because if they miss it at their young age, they will have problems in adulthood. Thank you, and over.
Thank you very much. Memunat, please, I have to call on you again to ensure that the people can be muted on time. Okay. Thank you very much, Dr. Eno. And MHR is very, very big on storytelling. I remember an issue where we had an inbox message. We keep our inbox messages as anonymous as possible, but we also ask if we can share some of the stories that we received there on the front end. And this person gave consent. But after a while, I realized that we might have to understand better some things before some people take it away. So obviously, this young man who was 17 at the time he had his first sexual encounter, and then the lady he had it with told him that he has a very small penis, and so he could not sleep at night. Just imagine a 17-year-old boy hearing that he has a small, and he was googling, he was checking, and what he was seeing online were so scary. At a point he concluded, because when he entered into our inbox, he concluded that he has a micro penis. And we asked, so how did you measure this? He said he used his hand to put where his thumb starts up to where his index finger gets to. Imagine these situations. I remember we had to, of course, have long conversations with him. Luckily, there are really good resource videos on the Love Matters Nigeria website, connected with the Amaze videos, where you can learn a lot about puberty, because many Nigerian young people didn't learn deeply about puberty before they stepped into young adulthood. And so someone can just talk to you, and then you just take it from there. Oh, I have a small penis, and you put that in your mind and stick with it. Dr. Eno.
Yes, thank you very much for raising that. And I just want to say that Google will always tell you what you want to hear. What you're afraid of, that is what Google will tell you. What you're scared of, that thing, your highest fear is what Google will tell you about. Google will actually give you more stress because you want to know about something. Now, and you have touched a very critical point, body image, how we look at our bodies, what people tell us about our bodies. On a daily basis, I am amazed by the kind of quests and the kind of worry young people have. You know, I will not tell the number of people who have reached out to me because they have small penises, and at the same time, someone is reaching out to say their penis is too big. How can they reduce it? And recently I was on live on TikTok, and I was saying, just now somebody had just written to me that how can they increase their penis, and then another person is writing to me that how can they reduce it. And if you don't know the reality about penile growth, age and the length of your penis, you might think what you have is a problem. Meanwhile, you don't even have a problem. It could just be, your personal belief. It could be the way you feel about it. And it goes on and goes on. Somebody can say, okay, my vagina is too wide. Who tells you your vagina is wide? How did you know your vagina is wide? Because I had sex with someone and they told me my vagina is wide. How? Can your vagina be wide? The vagina is elastic. So you see, there are a lot of misconceptions, and that young person goes with it, and it torments them. It torments their relationship. It torments their emotional well-being, and then they start fearing and shying away from people. Imagine that 17-year-old young boy. I think he will end up running away from women because someone told him that his penis is small. Meanwhile, it's not what it is. So I think there's a lot of misinformation, and unless young people learn and get accurate information, it could harm them. It could, fashion the way they think, fashion the way they behave towards the opposite and same gender. Yeah.
Thank you very much. Thank you, Akin. I see your question for Dr. Eno in the comments, but first we'll just move to Madam Alu Azige for a little bit. So yeah, Madam Alu, I want to ask one very important question that really concerns young people. So choice and consent are often discussed separately. People tend to talk about choice and consent like two different words that mean different things, and we agree with that. But when it comes to SRHR, choice and consent for us are very closely linked. I want you to shed more light on why it is important for young people to understand these concepts, choice, consent, and why they are linked when it comes to sexual reproductive health.
Okay, thank you so much, everyone. Good evening. I was just enjoying Dr. Eno, and I was hoping Dr. Eno will speak till the event ends. Because, I mean, we don't find you always, and it's a great honor for us that you made this time available. But I'll give a bit of information around what you have asked, and please, I beg, so we just round up with Dr. Eno. Is that okay? Now, for choice and consent, it is vital for young people, especially the ones on the call now, and probably everybody in our community, to understand that choice and consent are actually very interconnected. There are a lot of educational initiatives that could promote awareness of both concepts to ensure that individuals not only have the information needed to make the informed choices, but also, their SRH, and they get to understand the mutual respect and agreement of all the interactions that have to be in play. But the concepts of ignoring either one of them are very consequential. And those are the things we like to talk about in MHR. Those sensitive conversations, those taboo-like conversations, and it's important that we understand that, these importance are from empowerment to, healthy relationships, to respect for autonomy, bodily autonomy, right? And also, to prevent violence. A lot of the issues we have around gender-based violence, for instance, are around choice and consent, right? And it's important for us to know that if we ignore them, if a boy ignores the fact that he's not supposed to be violent to a girl, the consequences will be a lot, right? And so the outcome of ignoring this will be a lot. Compromised autonomies, health risks, lots of health risks. A boy would have sex with you without using a condom or without using a contraceptive. Or he'll tell you, oh, I'm good at withdrawal, and you don't know what his STI status is. One of the things we're trying to really promote in MHR is to make that first question important in early relationships. Do you know your partner's STI status? It's really important. If you don't know, use a condom. Insist to know their status before, a sexual interaction takes place. I found for your engagement in your conversation this evening, it was difficult for you to pronounce penis, vagina. Yeah, in MHR.
African, the
So
African in
I
me.
know. No, I mean, we're African, but that's the narrative we're changing, right? We're changing these narratives one program at a time, one post at a time, and we must continue with it. You know how I'm open about the issues around my, sexual relationships and sexual reproductions. So it's really, really important. But let me allow Dr. Eno. One of the things I wanted to just emphasize on is the negative impact on our mental health for young people. Just imagine that 17-year-old boy, not fully understanding or even respecting consent and understanding what that means. It can lead to feelings of guilt. Look at your father and tell your father, oh, you gave me a small penis. Shame, lots of anxiety. Sometimes someone feels they were forced or manipulated into a situation they were uncomfortable with. Why would you force this person, right? So it's an interplay of choice and consent. When I choose and I tell you my choice, please respect it. We've continued to preach the shortest sentence ever. No. No is a statement. When a girl, when someone says no, they don't mean try harder. They don't mean, oh, I'm just playing hard to get. No, they mean it. Even if you see that they don't mean it, please respect it. Okay? So thank you so much. I think I've been able to throw some light around that, but I know Dr. Eno will speak more to choice and consent. So over to you, Dr. Eno.
All right, thank you very much, Alu. I think you've spoken quite well. I think I will just hand over the mic to the moderator to continue with the next question.
Okay, thank you very much, Dr. Eno. So I just wanted to note that these conversations are important to us because they arise from many questions that young people have asked us inbox, young people have asked us in comments, and we periodically release some forms to see where our heads are at in Nigeria. I mean, we have campus activation, so I would like to think that most of these conversations are questions that might just be roaming around in our heads, and we are looking at today's event to tackle some of them. So I'm really hoping that many of us are picking some very, very important points from here. Let's also keep in mind that there'd be a quiz at the end of this plenary that would give the chance for people to be winning cash prizes. So yes, let's stay tuned. Dr. Eno, I just have two more questions, and I'd push this to an end. Yes. Can you help us do a little bit of information, give a little bit of information about the differences between safe abortion and unsafe abortion? Now, in our context today, a few days ago, I saw one of an activist's status where she was like, "Oh, people should not add safe to the word abortion. Abortion should just be dropped out like that." And I tried to explain to her that it's the context that we are in. Many of us grew up with thinking that whenever we hear the word abortion, what we are hearing is blood and death and gore. And when we grew up, we now started learning for the first time that abortion can be something different. So when we in this space try to tout the word safe abortions, we are trying to continually push on people that this can be safe. So we want you to just give some light to it because of our self-medication culture, especially in this context.
Yeah. Yeah, thank you very much for this question. And you've touched a very, very nice, interesting, another topic again. Now, when we talk about abortion, the difference between safe and unsafe abortion is not about why someone is having an abortion. Let's first of all clarify that. The difference is not about why someone has had an abortion. It's about how it is being performed. So when we talk about safe and unsafe, it's not why they are having it. It's about how it is being performed. Now, a safe abortion is when you use a recommended method, a WHO recommended method. For example, there are two methods. There is the medical and there's the surgical procedure for a safe abortion. And again, it has to be managed, by a trained provider. So there are two things involved for safe abortion. You are using the recommended method, and then it is done by a trained provider. It means it's safe. There is no problem in having an abortion. Let me first of all make that clear. Now, countries and contexts differ when we talk about the laws of whether abortion is legal or not. But medically, there is a recommended method, or there are recommended methods for safe abortion. And it's in the how that defines safety, not in the why. And so for safe abortion, we talk about, medication abortion, where you use pills, depending on how far the pregnancy has gone. And then surgical, for example, manual vacuum aspiration, again, depending on how far the pregnancy has gone. The indicator here is the age of the pregnancy. Now, unsafe abortion has to do with the dangerous methods we use. We go to untrained individuals. Dangerous methods, for example, you go and drink honey. You drink limes, and all those toxic things, products, which we take bleach, vinegar, to have an abortion. Also, it has to do with untrained individuals. You go and meet some quack in the quarter, they tell you he has been doing abortion for many other girls, and then you go and meet him or her. Untrained individuals is considered unsafe. You get counterfeit medicines. The medication pill is not an over-the-counter drug. It means you cannot go and buy like paracetamol or Panadol. No, it has to go. It's given to you through a doctor's prescription. So you cannot go and buy the medication for an abortion over the counter. You need a prescription for it. So if you go and get the counterfeit medication, it's considered unsafe. Again, you have harmful practices such as using a fork. Recently, I think 2 months ago, there was a case that was brought to me. A young girl, about 14 years old, from a boarding school, used a hanger. And I was so shocked that someone uses a hanger to bring the content of the content of conception out of the uterus. Some people insert objects. Some people use forks. Some use hangers. Some use, I don't know, different things to insert. And then you can imagine the harm it causes to them. That's all unsafe abortion. So the main difference between safe and unsafe abortion is really around how it is being performed, not why it is being performed. Now, unsafe abortions can cause a lot of bleeding. You can have severe bleeding. You can have infection. I love the uterus of a woman. You see that thing called the womb? The womb in medicine, we call it the uterus. The uterus of a woman will never stop bleeding until it is empty. If there is something in the uterus of a woman It will bleed until that thing comes out. That is the good thing about the uterus. It's a very dangerous organ. When I operate on a woman and I see the uterus, at times I can even pee on my pants. Because when you want to start bleeding here, you can run. The uterus will bleed until the object inside comes out. So there is a lot of severe bleeding due to unsafe abortion. Infection can kill you. Injury, you could have, a uterine perforation. You perforate the uterus. You have a serious internal injury of the organ, and it can even cause death in some cases. Just leaving medical school, I can never forget this incident I had. The first case of abortion I had, the lady died in front of me. She came in a pool of blood, and I was on call. This was about 1 a.m. Before you call anesthetist, before you look for blood in the blood bank, she went in front of me, and he will never leave me because I saw it happen in my eyes. So it's a very risky thing to do when you use dangerous methods. And so that's the main difference between safe and unsafe. Safe means you use recommended WHO methods. The medical one and the surgical one, depending on the age of the pregnancy, and you must do so by a trained provider. And unsafe means that you involve dangerous methods by untrained individuals, or you even take harmful products, to have an abortion. But abortion in itself is not a problem. It is how that becomes the problem. So, as a young person, there is no need to risk your life because you lack information in 2026. If you're pregnant, go to a healthcare provider and get all the information. It is your right to get information. It is your right to get adequate information. And so I think that is the main difference, if I've answered your question. Over to you, Ifoma.
Thank you very much, Dr. Eno. Yes, at this junction, I would like to just note that while a lot of people think that abortions are illegal in Nigeria, they are not. They are just restricted. So there are clauses that make them not illegal completely, just restrictive. So you hear in context where it is to save the woman's life, then yes, abortion is very much allowed. So you see people who have ectopic pregnancies, problematic issues, it works out to save women's lives. And if a medical practitioner certifies that it will save a woman's life to have an abortion, then it is allowed, which is why the word is not illegal. And then to be clear, there are a lot of issues that surround women's health that make women and girls need abortions. But in somebody the Nigerian community will say as an adage that if it's only your father's compound you have seen, you would think your father's compound is the world. You just see this compound, you be like, wow, it's so big. Then you be like, that's the world. Once you go out, you may never understand what the world really looks like, and that's why we had an intervention called Toba Shewa, What If It Were You, where we were talking about, we pushed storytelling as a way to make people see the other side of many women's realities. There are women who have been sexually abused. There are teenagers with pregnancies. There are married women whose contraception failed. There are so many reasons why this might happen, and we always push that before judging, choose empathy. Dr. Eno.
Yes, thank you very much. And I really want to stress on a very important point based on my experience, the role of boys and men. You see, the problem of abortion, pregnancy, I tell you from my experience, is from boys and men. I have noted that most boys are the ones that push the girls to go for an abortion. Some even go and bring the pill. They don't even know what they have taken. I remember a case just last week where a young girl told me she drank something that she doesn't even know, but her boyfriend has been giving her. So boys have to be more responsible because some of them push the young girls to go for an abortion. Even when we talk about the withdrawal method, it is still the boys. I'm a sharpshooter. I will not pour it inside. Don't worry. I have experience in this thing. I'm a sharpshooter. That's what they would say. But sharpshooter is what will bring you that pregnancy. And then you'll be the first person to say, go and abort. In reproductive health, I always say, your body, your choice. It is your body, it is your choice. Decide what you want with your body. Let no man pressure you. Let no woman pressure you. It is your body, it is your choice. But I really want men, because this conversation we're having is not only for women. Abortion is not a woman's issue. Abortion is not a woman's issue. Pregnancy is not a woman's issue. A woman is not conceived by the Holy Spirit. A woman does not get pregnancy by the Holy Spirit. Pregnancy is from two people. The egg must meet the sperm must meet the egg. And so men are not left out. men have a role to play. They have to become more responsible and aware so that it makes life easy for the woman and the young girl. Yeah, thank you and over.
Thank you so much, Dr. Eno. You've said above and beyond for what one of in fact you've touched at the heart of what we were aiming for to say today. One of the major goals of today was not just to let everybody who is attending know that there are options and to be aware that your body is not a desert that you just ignore and ignore and just let it just be taking care of itself, but to know that just imagine a large organ that you have to take care of, and that's a lot of what Dr. Eno has touched on. But majorly, one thing that's touched me personally is the fact that pregnancies don't just fall out of heaven. It takes two. Unfortunately, it's just one gender that is punished for it. So whenever we are saying some things, we should just remember that two people did something, one gender is getting punished for it. Two people did this, one contraception failed, because in many cases contraception fails among people who have multiple children, and then one gender is the one that decides, you are the one that will do for how you are going to sort this out. It's you, it's your problem. It's one gender that is dying for it. Nobody is hearing men die from maternal mortality. It doesn't happen to me yet. Sex can only happen when pregnancy can only happen when two different people bring DNA together. Yeah, so we'd have the next 5 minutes to just take questions from the chat. I want to crave your indulgence again, Dr. Eno. There are some questions in the chat that I would really like us to tackle. The first one is saying, Dr. Eno, are healthcare providers truly able to answer SRHR questions without bias? If so, how can young people approach them to access the support they need? This question is particularly for the African context. Yes, sir.
Yes, thank you very much. My answer is yes. Yes, but not always. Many healthcare providers are trained to provide SRHR in a very respectful, evidence-based way without judgment. But unfortunately, that's not what happens in most of our context. Unfortunately, some healthcare providers tend to judge the young person. Now, we were not trained as doctors to offer services just to young people. Some doctors don't even know how to relate with young people and their SRHR. And so because of that, some can become judgmental, some refuse to be objective, some even judge your sexual orientation. It is not in my place to care whether you are a lesbian, you are a gay, you are a bisexual, before I offer a healthcare service to you. As an individual, as a person, I have the right. I am bound by the Hippocratic Oath to offer good and evidence-based healthcare to you, regardless of your sexual orientation. And that's why I think it's important that we continue to invest in the training of healthcare providers on how to provide a youth-friendly, right-based, and non-discriminatory care. I should not discriminate when I'm providing a healthcare service. And so I agree with you that yes, but not always. And then for young people, my advice is that don't let the fear of being judged stop you from seeking care. Because at the end of the day, the consequences at 60% or 70% will fall on you. So don't let the fear of being judged stop you from seeking care. Everyone is battling with something in this life. I wish young people could hear me and hear me well. Every human being is battling with something. Everyone has a problem. You are not alone. What you're suffering, somebody could be holding the key and the answer to that problem. So don't let fear of being judged stop you from seeking care. Don't be shy. Everyone talks about sex. They could talk about it in hiding, but everyone talks about it. Man is a sexual being. When I mean man, I mean both male and female. Man is a sexual being. So there is no way you can avoid it. So look for a youth-friendly health facility, to speak to a provider who work with young people. And remember that you have the right to ask questions. You have the right to ask questions. You have the right to receive accurate information. You have the right to your privacy and confidentiality. Is your right. And so as a young person, please don't be ashamed. Don't be afraid that you'll be judged. And that should not stop you from seeking care.
Thank you again, Dr. Eno. The next question, a very important one that comes our way very often. Those of us who are against, I want to abort just because I don't want to be pregnant. You don't consider it murder. I encounter this question a lot in my work. in our work. I can't just imagine how many times we must have come across this question. And I like to think about it this way. One day we were in a gathering. I'm talking to creatives and artists about this, and one man stood up and raised a very valid point. Or when he went to Jos, he went to a club one evening and he saw multitude of young girls dancing in the club, shaking their waist, and he was just thinking, all these promiscuous girls right now will just be getting pregnant and they will just be aborting. So whenever he hears these conversations, all he's thinking about is them. And I thought about it, and the scenario that came to my mind was the recent ban on tinted vehicles, and how Nigeria is the Nigerian police has been clamping down on it. Now, tinted vehicles are needed for different reasons. Some people have health challenges. Some people have children in the back who the sun will be affecting. There are just so many reasons. But the world globally has had to clamp down on tinted vehicles because of criminals. So the truth now is that all the other health issues, security matters, there are people who really shouldn't be seen outside, celebrities. So many other reasons are up. Yet, because of this one issue, all those people were at a point stopped from using tinted vehicles. And then the law began to consider it. Would it be good just because of these people that are criminals, we inconvenience the whole world because of this one issue? And so the permits came out as a solution to that problem. Now, here we are. Another would be the matters of students dressing indecently to campus. And then the idea was that stop all girls from wearing trousers. That's the way abortion is. There are young people getting raped. There are women whose situations are really, really pathetic. We've seen 12-year-olds that are carrying the babies of their fathers. Now, when abortion is restricted because of the thought process that, what of the people who are getting it just because they are promiscuous, we end up covering everybody who needs abortion with the whole stigma and propagate the cycle of unsafe abortions. Because when we clamp down on abortions, we are not ending abortions. What we are ending is the safe abortions. People have been dying. Up to 20,000 girls and women die of safe abortions in Nigeria yearly. So you just imagine how many plane crashes. If a plane crashes, 200 people die. Now count it to 20,000 people. And imagine the death toll of people that are dying of unsafe abortions. So we are not stopping abortions. We are saying, for having this pregnancy, you have to die. For saying this, you must die. That's what's going on. Meanwhile, when the situation comes down to it, a man who is standing in front of a doctor, and the doctor says, it's either your wife or the baby, or it's either your wife for this pregnancy, or this situation, we'll be like, oh yeah, that works out for us. At the end of the day, who is the judge, who is the jury, and what happens to all the young girls and women in between? So when we try to think about it like that, it really helps to put a lot of things in perspective. We now really do not care about the choices. What we are hoping for is that women and girls have access to sexual reproductive health products that are needed for quality life. Thank you. I'm happy that Dr. Eno wants to add. Dr. Eno, please.
Yes. I wanted to add on this issue around abortion and the choice. Some people are pro-choice and some people are pro-life. Some people are pro-choice, some people are pro-life, and that's what the person in the chat, the Manuela, asked in terms of don't you consider it as murder? Now, from my experience, you can hardly stop a person who wants to have an abortion. From my experience, if you stop them from having a safe abortion, you would meet them later on with an unsafe abortion. And it happened to me in my early practice as a young doctor who left school. I used to be very pro-life. And then I would tell you, oh, it is not good. You can keep it. You can do, you can. And then 1 week, that same young girl will come in the hospital in a pool of blood because she went to the quarter and then she had an unsafe abortion. And then, ironically, I am the one that will finish it. I'm the one that will clean off and finish the abortion. So it falls back to the healthcare system. And so I find it difficult that you can convince somebody from not getting an abortion, somebody who has made up their mind from getting an abortion, that you convince them. I find it very difficult. I think when you talk about pro-choice and pro-life, it's quite subjective. I am of the opinion that let the person carrying the pregnancy decide what they want to do with the pregnancy. Let them decide. Let the woman decide for her body what she wants, because that pregnancy cannot survive out of that body. That pregnancy needs that body to survive. And so it is about her choice to whether to carry the pregnancy or not. At the end of the day, if she does not survive, what gain have you? And as a matter of fact, it is more of a public health concern than an individual approach. Because as government, even I think even in Nigeria, the government is spending more on unsafe abortion. And I wonder how many people are criminalized because of the fact of abortion. So to me, I think that it's a matter of let the woman decide what she wants to do. So if she wants to have an abortion, give her a safe method of having an abortion. Let her not die because she wants an abortion. Having an abortion should not be a death penalty. It should be safe because it's a normal process. And to give her a safe abortion so that she can have a good life. And last week someone asked me, when is the right time for me to get pregnant? A young girl asked me, the doctor, when is the right time for me to get pregnant? When is the right time for me to have sex? And my answer? My answer is when you are ready, when you feel ready. It's about you. It's not about what people say. There is no law that says that you must get pregnant at the age of 20. It's about you. When are you ready? When you are ready is the right time. When you're ready to have a pregnancy is the right time. When you're ready to have sex is the right time. And you can be ready as well as you cannot be ready. That all depends on you. That is how we should see life and not impose things on people. I find it very wrong. As a matter of fact, let the woman decide. It's her choice, it's her body. So that's my perspective around, pro-choice, pro-life, and murder when it comes to abortion.
Thank you so much, Dr. Eno. We'll be moving to the quiz now. Aisha Nuruddin, what are the most common myths about abortion and what are the actual facts? We've mentioned a few in this session, but I can just do a summary. A lot of people just assume that abortions are naturally unsafe. The Nollywood, our movies have not helped the matters where they just keep showing bleeding girls on the floor, dead young students and all of that. Abortions can be safe. They can be safe. As a matter of fact, the procedures, somebody was described it as a procedure that is even safer than carrying the pregnancy from A to Z, from the first month to the 9th month and childbirth. So it's not always, it doesn't always end in blood the way that we think. Yes. Are they illegal? No, they are not illegal. They are just restricted because in Nigeria they are allowed to save a woman's life, and that's a very large caveat, which is why many CSOs have been working towards ensuring that all states of Nigeria adopt STOP guidelines, safe termination of pregnancy guidelines, where that phrase to save a woman's life can be broken down. The Maputo Protocol, which is an African treaty, a charter that Nigeria has signed to be part of, but is not implementing currently, notes that in cases of abuse, that's rape, incest, where a father impregnates the daughter to a brother and sister, because of the dangers associated with such situations, those cases should be allowed. Abortion should be allowed on grounds of that. And of course, a lot of people say, oh, the moment a woman is abused, a woman is raped, or a girl is raped, she should immediately go and take the morning after. How many girls know that? There are girls getting raped in the IDP camps. There are girls that do not even know about their body. I mean, Dr. Eno was talking about the depth of lack of knowledge that is currently prowling our countries, and how young people need to actively go and seek information. But how many people know this? How many of us are privileged to attend events like this, where we know that there are things like morning after, there are contraceptive methods, especially after cases of abuse? How many young women know that after abuse, you shouldn't even take your bath? You have to just go and report so that they can get DNA. Many women don't know this. Before you know it, traumatic situations. We had one that came into our inbox of bandits, and the woman told the husband that I will kill myself if you don't find abortion for me. Of course, the man had to go and look for some unsafe methods until he ran into Love Matters Niger, and things were able to get clearer. So yes, this happens. Where do we stand from the perspective of religion? We are asking for empathy. That's basically what we are asking for. Before you condemn that person, before you say, oh, this person is going to hellfire just because this person sins worse than me, because that's one of the major problems of Africa as it stands. The idea that because this person is not sinning the way I'm sinning, I mean, must be a bigger sin. This one is a smaller sin. I just lied today. Do you have to die because you lied? All we're asking for is empathy. Have empathy. Empathy ends stigma. Empathy breaks silence. Where people come and they are scared to talk to you because they know that you lack empathy. One person told us one day in one of our activations on campus that the day she told her friend that she was pregnant, she went for a party and some stuff happened at the party. By the time she woke up, she doesn't even know what happened. Somebody probably gave her a drink. Bottom line, she woke up and she was fine. No, I mean, until she had moved on from the experience, until a month later when she missed her period and found out she was pregnant. And she told her friend, and her friend who has no bearing on children was telling her that she should just pray and pray until she said she just told the lady okay and left. And by the time she nearly lost her life because she went for an unsafe abortion, the lady was not aware. The lady was shocked eventually. So if just imagine that person had empathy rather than just passing judgment, things might just have been different. She might have been able to even talk her down from nearly killing herself. What we can do as individuals is also to educate people about abortion and safe abortion. Thank you very much, Omolara. For us, that's the goal. Everybody goes off with information and empathy, because empathy, like we've just said, stops stigma. You just imagine that you are looking at the person you are looking at, you can save the person's life. But in the words that you say, Abba, how can you do that? Are you not this and that? Just go and pray. And the person just looks at you and like, you will never understand what I'm going through. As opposed to imagining yourself in that situation, not just the hypothetics, the real deal, and joining that person to seek information. And we can tell you for a fact that one of the best places to seek accurate information is on Love Matters Niger. We have partnerships with and partnerships and programs that can help. If you enter into our inbox on Love Matters Niger, you get information that you need. If you visit Paddy Chat, you get the information that you need. That's paddychat.ng. One of the content officers will put some of those links in the chat. And then, of course, you can just go to lovematters.ng. You see a lot of resources. If you scroll down a little bit on the front dashboard, you would see link to amaze.org videos. These videos, you can just click on click on the link, and then you can see the list of titled videos where you can click that redirects you to amaze.org. You see things about puberty, your body, contraception, consent, and so much more that are being adopted for you specifically. And very important too, like I mentioned, our inbox where you can get actual guidance. Just follow us on Facebook and get it to the inbox. I'm joining everybody here to also follow ajoshe.ng to learn a lot about what women are going through and how to, as a man, as a boy, as a woman, how to support people, how to really understand what is going on. Please follow ajoshe.ng, ajos.ng. Please follow ajoshe.ng. Your eyes will be opened to a lot, to be honest. You just see that this life is not just what you are seeing around you. There's a lot going on that people are going through, like Dr. Eno said. People are going through a lot. And a kind word, understanding, empathy would go a long way to helping them. Thank you so much, Dr. Eno. Thank you very much, Madam Alu, for the insights that we have received today. We hope to end this session at 7:30, so we'll be going into a quiz where people stand to win cash prizes, like I said. This quiz that we are going into, that Memunat will be chairing, it's not just about first come, first serve. I want to see your depth of what you've learned from Dr. Eno, what you've learned from Madam Alu's conversation today. I want to see how you're seeing it. And then please don't forget that for attending this event, you are entitled to data stipends. So please wait till the end so you can fill our post evaluation where we'll be collating your numbers. The gifts for the quiz are cash prizes, but the for attending and you fill in your number, you get data stipends to your phone number. So please stay to the end and don't miss out on anything. Memunat, are you ready? Memunat?
Yes, I'm ready.
Yes. So
Yeah.
please, let's have our quiz. Thank you very much.
Thank you very much. Thank you, Dr. Eno. Thank you, Madam Alu, for this very loaded conversation. I'm sure we've learned a whole lot. We've heard things that we've not thought of before, or we've not heard before. So quickly, let's go straight into the quiz. Get ready. Hope you are you are, or you have your finger there. So we are going to first share a link. This link will let you write your name. Now, this is just to get your name so that when you eventually answer the questions of the quiz, we can know who said what. Okay? So I've shared the link now. Use this link and write your name. Then wait for the quiz. You can just wait there. The quiz will just appear. Or I could share a different one. But it should basically. Let's give 1 minute for that. Please click the link and write your name. I'm waiting. Okay, I think it's been 1 minute because it's very, very easy
Big
to
meeting.
understand, easy to do.
Yeah. I don't even dey sure. I don't understand.
Are we all there now? Let's activate the quiz. All right, so now the quiz is active and you can answer our questions really quickly. You need to give us the right answer and you need to give us the right answer fast so that you can qualify for the cash prizes. Sharing the link again in case you haven't gotten it.
The quiz is not loading. I think it's just stuck on an amount of people who have joined. Please, can you check that?
Okay, let me see.
Or do people have to reload for the quiz to reflect?
You could reload. I can see people that have added their names here. About maybe like 20 people here.
Yeah, it doesn't
The
open
quiz is
after the
not
reload. It
showing.
doesn't open after the reload either. It's just showing us that 20 people have added their names. It's giving us an update
Okay.
on how many people have added names, but the quiz is not loading.
Okay. I've activated it again. So you can try now. I reactivated the quiz. Let me know if you can answer the questions.
I cannot. I know that I don't know if it's just me though, but if you cannot, please just let us know in the chat too. It's
It
still not
does
showing
not
yet.
showing. Nothing
I
is
see
showing.
21 participants have already joined.
What the hell? Okay. They should all be coming live now. Okay, I can see answers now. People are
Or is it up now? Please, can we see it?
yes,
Mine is
Yeah.
not up.
Yes, it's up.
Oh, yes, it's up. It's up. Thank you.
Okay.
I think you can increase the speed for the answer because it seems like once you click, you cannot send until you move from there, from that question. You understand what I'm saying?
Yeah.
Good evening. Please, I'm not seeing anything here. I'm not seeing any link.
In the chat box.
Please share the link in the chat box again for those who are unable to join in. We must get
Sean,
champions today. Oh. People must win. Oh. They've shared it
sorry,
again, please.
when you click and join, the questions just run past you and just leaves you with the last question.
Oh no.
So I think you have to restart the quiz.
They are coming one by one.
Yeah, it
Yes,
has
but
been refreshed.
very fast, very fast. Before you can even read the first one, it just clicks and goes to the next page.
I think it just went back to the first one, so that's what
It
happened,
went
but
to the
it's
last,
moving now.
number 6.
That box is not showing on my.
Oh, so it just goes to the end. Should we reload?
No, we are currently at number one.
Well, currently
Okay.
number one.
Okay. Yes,
Yes.
you are
So
back now.
that's like, yeah.
Okay.
Then I would move to the next one.
All right, move.
We're all done.
Yes.
All right.
Chisom Blessing is still asking for the link. The link has been posted multiple times. Please, can you just check the chat? The link has been
Please,
posted.
my network is bad. My network is supposed
Sorry,
to
I
get.
want the link for the name.
So
Okay,
I
check
want,
Can
I
you
again.
don't.
check
Check
the
again. The
link?
link has been reposted.
Like, it's
Just
not
check
going
again.
anywhere.
Okay.
And I
The
keep
link has been
doing it.
reposted.
Yes, I've reposted the link, and then now we are at the second question.
I want. God, network is bad. Airtel.
I'm sorry, this tends to happen actually. You might not be able to do anything about it if your network's bad.
Sorry, am I to join Slido?
No, no,
Wow.
you don't need to register or anything, but you do need to write your name.
Yeah, that's what I want to do, but I shouldn't join Slido. Welcome, welcome to Youth Hangout. Join.
Emanat, let's move.
All right. We got 20 from that, so that's all. Then we are at the third question. The third question, yes.
We may have to move a bit faster just so we can meet up with the time.
Okay.
Yes, please. So let's move so we can see our champions and then we move. Thank you.
Fastest finger.
Fastest fingers.
All right. Now we're at the fourth one. Okay. I'm going to move quickly to get your answers in. Fifth question is live.
Are we moving?
Yeah, that's the last one. We did the last question first. So that's all.
Oh, my.
Okay. Okay then. So we'll be expecting that Memona to share your screen so that once the leaderboard comes up, we can see the winners and
We will
celebrate
all
with
see
them.
it.
Yeah?
We will all see it from the
We will all
page
see it.
that you.
Yes, yes. So Memona, just share.
Okay, hold on. Let's get to the leaderboard. Okay, I'm going to share my screen now. Here we go. This is our top 5.
Indomie fits well with
Okay, Deji Omolara.
Who is this person this person got it in 46 seconds. Wow.
Wow.
delicious fried egg.
Okay. Then Mimi, they have Rose Ape, we have Oluwatoyin, and then we have D. These are our top 5 fastest answers and all
Because of
correct
network, I
answers.
know we in the church, but the amount needs to be big. Oh,
Oh my goodness.
why it is that they
Oh,
pay?
I think I did write my name. I
My
just want to know if
God,
I'm.
none of my people can even wait.
Okay. All right. Yeah, so this is our these are our winners.
Mm, okay.
I saw the best. Okay, good.
Okay, so I guess we've all seen that now.
Okay, thank you.
Whoever, yeah.
Thank you very much.
Hello, please.
Omolara,
I
I'm
still
sorry,
haven't write
Memunat,
my.
please can you share that again so that we can see the 5 people who have won?
Okay. So we
Find
have
Okay,
anything.
so
Okedeji,
Okedeji, Omolara,
Omolara.
Mimi, Rose Ape, Oluwatoyin, and D. Congratulations, you have won our cash gifts. Thank you very much all for participating in this. Please share your full names in the chat. And your share your full names in the chat. And HR, how do we get this your names and the phone numbers? Probably just put your names and your phone number so that you can and they can reach you. Thank you
Yeah,
very
names, phone number, and account. Just names and phone number. Reach out to them for account details.
Thank you. Thank you very much. So please, as we are rounding up, please, the Akin will put a link in the chat. I can put a link in the chat to the post evaluation. This one is very important because that's where you'll be getting your data stipend for attending this event. That form collates your phone number that has your phone number that data will be paid to. So please ensure that you fill it before you go. Akin, please help me to share this multiple times so that everybody sees and we don't have the network issues again. I'll say that again. There's a link in the chat shared by Akinola Dabiri. Please, that link is very important. Please don't put your name in the chat. You have to fill the link. If you put your name in the chat, your number will not be collated from there. The only people that are putting their numbers in the chat now, the 5 people who just want the cash gifts. Those are the ones that if you don't fill the form, please note if you don't fill the form, you may not get your cash stipend. That form is where numbers will be collated from. So please check the chat. You see it. It's a link shared by Akinola Dabiri. You see forms.cloud.microsoft. Please fill that form. That's the form that numbers are collated and data stipend will be shared from those forms. Please fill it. Please fill it. I'm saying this so that people don't reach out and say, oh, I put my number in the chat box. No, we're not collecting numbers from the chat box. They're only taking the phone numbers of those who won, 5 people who won the gifts, the cash prizes. Those are the only people. And your name is, we have the name, so we'll just compare the name with the winners. Who is D? D-E-E. Who is D? Please, if you are D, you have to specify. Because okay. So Diane, please share your details. Thank you. The link to the form is being shared. Uh, please let's fill the form. Please let's fill the form so that we can get your numbers for data refund. Thank you. As we fill the form, I want to thank everyone for participating in this online live. I'm hoping that if you have questions, you can reach out to us at Love Matters Niger. Ensure that you reach out to us. I mean, you can, I'm sure there are a lot of people here who are currently in our SRHR campus activation groups. But if you are not, you can just ensure you are following us. Step into our inbox if you have questions, if you have concerns. You can just check. We've heard Dr. Eno say that please ask questions because he who asks questions never loses his way. Please, let's take it very seriously. We can enjoy people in our spaces. Let's not have information that can lead, that people need, and they will go the wrong way and change the course of their life for, when we have the information to share with them. Yes, you can volunteer with Love Matters Niger or ajoshe.ng. Yes, indeed you can. If you are in any of our SRHR conversation groups, you can just reach out. Are you in any, if you're in any of our SRHR conversation groups for campus activation, you can reach out. If not, I don't want to confuse anyone with any link here because I need everybody to feel the link that Akinola has shared in the chat. Thank you very much. I see that a lot of people are already filling the forms. Please fill the form before you leave so that your data stipend is going to hit your phone. Thank you, Emanuela. Thank you, Chinenye. Thank you for those who are filling. Simon, your hand is up. Are you experiencing challenges filling that?
Please, I expect 33 of us in this group right now to have filled. I know we started with 41, so but I expect 33. We currently have 14. Please fill the form.
Rose Appa is asking how do we reach out to for joining the campus groups and all? Okay, I think you just shared your number here, so Akela will take note of that. Akela will take note of that and reach out to you, Rose Appa. Reach out to you to know what campus you belong to, so you can be in the appropriate group. Thank you. Please, if you have not filled the forms, please fill it because that form is where we are collecting the numbers for data stipends. Please ensure that we fill that. HR, please can we check from the back end whether we have the number of people who are filled so that we can close? Simon, you're raising up your hand. You want to ask a question? Simon Daniel.
Yes, I do. I've been tapping the chat section for almost 15 minutes now. It's just loading, I'm seeing. Nothing else.
At the chat?
Yes, at this section, the root chat, opposite and beside the participants and start a video.
Oh,
I've been tapping it. That's why I couldn't even participate for the quiz. It's not just coming up.
oh no. Okay. Okay. Do you have any friend around you who is also in this meeting?
No, not really. It's just me.
Oh, so how do
I
we get
think
your number now if you cannot chat?
the other girl that was complaining about it because she was saying she said something about Airtel. I'm using an Airtel line, so I don't know if it's general issue, but it's not coming up at all. I'm not seeing any link. The chat section is just opening and closing.
Okay. Okay, can you leave the meeting and join again very soon and see whether it will come up?
Okay, let me do that now.
Okay, I'll wait for you. Akahan Stephanie wants to join a group. Okay, you can put your phone number here so Akiola can take note of it. Thank you. Is anybody else having challenges filling the form? Is anyone else experiencing challenges filling the form or finding the link? Hey, chappies, how are we doing? How will someone know that his or her form has been submitted? It will show submitted. If it has been submitted, it will show submitted.
29 people have filled, so
29 people. Oh, that's it. That's so I think we just have a challenge of the people that are having challenges are just about 3. Enoch Faith, if you filled it and you submitted it, it will show submitted. Ibrahim Aisha Temitope wants to be added to the group too. Abdurrahman Aisha wants to be added to the group. Please put your number and
sorry, I'm putting the link here. So I don't miss the number with people that won prizes.
okay. Okay, so if you have indicated that you want to be added to the SRHR group, Akenla has posted the link to the chat. You'd see it here, chat.whatsapp.com. You can just click it and just join directly. Thank you very much, Rose. Thank you so much for this session. It has changed a mindset of mine and corrected some misconceptions. Dr. Eno, okay, I hope to learn more next time. That's very good to hear. Thank you so much for joining, Rose. We really appreciate you. You can join the WhatsApp, the SRHR conversation on WhatsApp through this chat and be a part of our community. Simon, is it up now?
No, it's not. It's still the same thing.
Okay. Can I call a phone number for you so you can reach out on WhatsApp and the link can be shared with you? Since you are unable to see the chat, so I can't even put it in the chat.
How much you share his phone number?
Simon. Hello, Simon.
Yes. I can hear you now.
Please call your phone number.
Okay, right now.
Yes.
090
090
24
24
66
66
49
49
56.
56. Okay. I would reach out to you with the link.
Okay, thank you.
Well done. Thank you very much. Remember, if you want to join the WhatsApp group, the link has been placed in the chat for you. Thank you so much for honoring our invitation and joining. We hope to see you in more of our events. And please, we are enjoining you to follow at joshare.ng. Great information going on. We believe that if you have a higher perspective, if you have other perspectives, there is no way that your empathy will not be built. And what is this world without empathy? So thank you very, very much for joining this virtual hangouts, and we hope to see you in future engagements. Do have a lovely evening and a good weekend ahead. Thank you. Thank you. Thank you, guys.